Lub-dub, lub-dub, lub-dub. This is the sound and the pace of a typical heart rate. Lub-dub, 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 lub-dub. This is the sound and the pace of my heart rate, or someone who has postural orthostatic tachycardia syndrome, more commonly known as POTS. By a show of hands, how many of you have heard of POTS or have met someone who has POTS? Actually, you can all raise your hands because I am a POTS patient. POTS is a dysautonomic condition. Dysautonomia is any malfunction of the autonomic nervous system which controls basic functions such as respiratory and digestion. POTS is a medical condition that has many symptoms, very difficult diagnosis, and trial and error treatment plans. According to the article Postural Orthostatic Tachycardia Syndrome, written by physician assistant Molly Paulson, POTS is most commonly found in females. The age of onset is between the teenage years to the age of 50. POTS is also more commonly found in high achievers. POTS often develops after a person has experienced a trauma in their life, a serious illness or infection, or after having a surgery. In the article entitled Postural Tachycardia Syndrome, written by nurse practitioner Lorna Busmer, POTS is described to have a variety of symptoms. The most common symptoms of POTS are dizziness, fainting, high heart rate, low blood pressure, and extreme fatigue. Other symptoms of POTS include nausea, lightheadedness, shortness of breath, chest pain, word loss, and brain fog, and those are just to name a few. Those who suffer with POTS use more energy to perform normal daily activities, such as standing up, when compared to a healthy person. Many people with POTS become very dizzy with positional changes, such as getting out of bed, standing up from sitting, or even just walking for a long period of time. Some POTS patients may even faint with positional changes. A POTS patient's heart rate is always in a rapid rhythm. I, for example, feel like I am running a marathon when just walking through the halls. Patients with POTS symptoms are often overlooked, or they are attributed to stress, depression, or anxiety. Nurse practitioner Lorna Busmer explains the process of diagnosing POTS is very complex. In her article, Diagnosis and Management of Postural Orthostatic Tachycardia Syndrome, she explains the diagnosis is based on patient symptoms along with 2 heart rate measures. These measures look at heart rate while sitting, standing, and movement. According to the article POTS The Basics, doctors also use a variety of tests and results to diagnose POTS. The most common test performed is the tilt table test. I, as being a POTS patient, absolutely dread this test. During this test, the patient is strapped in a lying position on a flat bed. The patient is then inclined to an upright position. The heart rate and blood pressure are monitored about every minute while in the upright position. In my experience, I become very dizzy and begin to black out about 4 minutes while being in the upright position. In the article entitled Postural Orthostatic Tachycardia Syndrome, physician assistant Molly Paulson also indicates that POTS has no cure. Experts agree that POTS symptoms are very hard to treat. Every POTS patient responds differently to treatment, so a lot of treatment is trial and error. Treatment plans for POTS include both lifestyle changes and also drug-related treatments. Lifestyle changes include drinking increased fluids and increasing salt intake. POTS patients have to add a lot of salt to their food. However, that might not be enough. I, for example, have to take 8 extra salt tablets a day. A consistent exercise program is also very necessary in lifestyle changes for a POTS patient. Other lifestyle changes include wearing compression stockings and elevating the head of the bed. According to the article, Diagnosis and Management of Postural Orthostatic Tachycardia Syndrome, written by nurse practitioner Lorna Busmer, drug-related treatment plans can also be used to help treat the symptoms of POTS. Doctors may prescribe drugs that can help decrease heart rate and increase blood pressure. With increased diagnosis and awareness, the identification of POTS is becoming more prevalent. Postural orthostatic tachycardia syndrome is one syndrome with many symptoms and is an invisible reality that greatly affects an individual's daily functioning.